personal views on abortion. Most people feel that it's completely wrong. It's either against their religion, their family's morals, or their personal morals. When they think of abortion, they think of basically killing a person, another human being, which in all countries is punishable by death. In other cases, some people feel that it's not really like killing a person because they're not actually breathing outside in the world. In the U.S. today, there are two kinds of abortions that you can get. One, the in-clinic abortion, is the most common of the two. The in-clinic abortion is a procedure performed starting at 5 weeks from the first day of your last period, up until the last day of the 13th week. It will begin with a preliminary exam and a test for chlamydia. The doctor will then inject a local anesthetic to numb you. After that, they'll use manual dilators and then perform a vacuum aspiration procedure that lasts about 1 or 2 minutes. After this, the doctor will then examine the tissue to verify that the procedure has been completed, and you will be given a prescription for pain medicine to use at home if needed. The second of the two procedures is just a pill, titled the abortion pill, but is widely known as RU-486. The RU stands for Russell Uclaf, the pharmacy clinic that created it, and 486 is the lab serial number. The U.S. Food and Drug Administration, or the FDA, approved the abortion pill in 2000 for use as an abortion physicant. The abortion pill causes an induced miscarriage, which is triggered by a drug combination that causes pregnancy to be terminated in an interval of 12 to 72 hours. The methotrexate, or mifepristone, is used to stop the development of embryo and placenta, while misoprostol is administered to cause the cervix dilation, stimulating the expulsive and uterine lining along the terminated pregnancy. You may experience heavy bleeding and nausea, vomiting, diarrhea, or pelvic pain, and also fever from using this pill. And you have to always keep in mind that through either of these ways that there is such a thing called a failed abortion. In this case, the ectopic pregnancy, there is at risk of a fallopian tube that will be damaged, which can also lead to infertility to most women, causing them to no longer have babies even if they wanted to. These two options seem rather simple, so most people, whenever they get pregnant by surprise or at a young age, they feel it's the easiest way out. That it's easy to go in, have a simple procedure done, or just go take a pill. But what they don't really think about is all of the side effects that are possible. There are many emotional and psychological effects to this. Regret, anger, guilty feelings, shame, a sense of loneliness or isolation, loss of self-confidence, insomnia or nightmares, relationship issues, suicidal thoughts and feelings, eating disorders, depression, and anxiety. You may have known about depression or the sleepless nights, suicidal thoughts, but most people think that will never happen to them. In reality, it happens more often than not in these women that have them. Abortions are very common, and in fact, 1 out of every 3 women in the U.S. are going to have an abortion by the time they're 45. If you're under 18, most states require that one or both of your parents give you permission or be told of your decision prior to the abortion taking act. It is estimated here that as of 2008, 28% of women between the ages 15 and 64 have had abortions. This figure has risen 2.8% in 1973 to 11% in 1980, 19% in 1987, 24% in 1994, 27% in 2001, and in 2008, women's ages 40 to 55, about 40% have had abortions in their lifetime, and the percent is still growing today. There's many other things you could do to prevent having a baby and having to go through the difficult choice of whether you need to have an abortion or not. You can not have sex at all premarital. You can have condoms. You can track where you're ovulating or not to prevent it. There's so many ways that you can prevent it. Not all of them are easy, but there are ways to prevent killing a life that doesn't need to be killed. The one option most people seem to overlook is adoption. Whenever you're pregnant, most people think the easiest way is to just get rid of it and pretend like it never happened, because they don't want to have to go through the 9-month process of having a baby and being pregnant. But in reality, adoption would be far less stressful on yourself and far more easier. With adoption, you don't have the stress of possibly being depressed from killing this life form that you created. You don't have the anxiety of wondering if you'll ever be able to have a child again after the process. You won't have to deal with sleepless nights or anger issues, nothing. All you'll have to deal with is having the satisfaction that you gave your baby a life that you never could have given it, or you didn't want to give it. Also, there are many places you can go that can talk to you about options you can have, whether you do want one or you don't. I feel that people shouldn't have abortions. They can go to Planned Parenthood. Almost every county has a place where you can talk to people, you can get counseling, you can have help to get you through the pregnancy. There are many ways that you can just get through it and not have to face that. And even if you don't want to tell your parents, there are helplines, there are counsels that they will be able to help you, and they will help you tell your family, they'll help you get through school, whatever you need. They have online classes if you don't want to go to school pregnant. They have just so many options, and there's so many people that will support you whenever, even if you don't want it. So that is my speech, and thank you for watching.